Hi there, everybody. My name is John Ward. I'm Director of Communications for the ACLU of Massachusetts. I want to thank you for joining us by Zoom and Facebook Live today for ACLU's second virtual town hall, this one focused on public health, privacy, and surveillance issues. I especially want to thank you for joining us during these challenging times. We really hope that you and your loved ones are safe and well. You'll hear shortly from our experts on COVID-19 privacy, public health, and surveillance issues. But first, I wanted to go over a few technical notes. Because this is a Zoom webinar, you're not going to be able to see yourself on video, and you're not going to be able to hear yourself either. Your audio is automatically muted. You'll only be able to hear the presenters. If you have any technical questions, please use the chat function on the right-hand side of your screen. The chat function will also be used by us to share resources and actions with you. There is a Q&A function as well. We encourage you to send us questions, and we'll try to get to as many as possible. We did receive a bunch of questions in advance, so apologies if we don't get to yours. Now I'd like to introduce our first expert, Robert Greenwald, a clinical professor of law at Harvard Law School and faculty director of Law School's Center for Public Health Law and Policy Innovation. Robert and the CHLPI team are engaged in state and national research, policy development, and advocacy to expand access to high-quality healthcare, reduce health disparities, and promote more equitable and effective public healthcare systems. Robert's been working in health and public health law and policy for over 30 years. He served as original director of law and policy programs at the AIDS Action Committee of Massachusetts from 1987 to 2000. And he served as a member of President Obama's Advisory Council on HIV/AIDS and as a chair of its Access to Care subcommittee for 6 years. So without further ado, here's Robert Greenwald. Robert, thanks for joining us.
Hi, everybody. It's really a pleasure to be here. I appreciate the opportunity to virtually be here with you all today and to talk about efforts to ensure we have a sound public health response to COVID-19 that includes serious consideration of our civil rights and liberties. There's no question that at times such as this, what might be in ordinary circumstances unacceptable becomes necessary in the name of public health. In short, extraordinary times often require extraordinary measures. But during such times, we also must remain vigilant to ensure that government responses are based on sound public health objectives and protect our privacy interests and other civil rights to the fullest extent possible. Today, I'm going to provide several examples of how governments are responding to the pandemic in ways that undermine public health. The last two examples will hone in on Massachusetts, with the last example specifically focused on challenges related to public health and privacy. Throughout, I'm going to attempt to offer alternative strategies that would help to improve public health outcomes in addressing the pandemic. Now, the response to the pandemic across the country has raised many civil liberties concerns, especially as to the health and well-being of vulnerable communities. Here are two quick examples of the kinds of policies that must be stopped. As many of you may know, we now have a cure for hepatitis C, pre-COVID-19, the #1 communicable disease killer in the United States. Despite health and public health experts imploring state governments to comply with laws that require access to HCV treatment, many states are refusing to do so. Their objection has partly been based on cost, but today at approximately $20,000 per course of treatment, can you imagine denying access to a cure to cancer, MS, Alzheimer's, if a cure existed at that price? Here we're talking about a communicable disease that largely impacts some of our most vulnerable residents, as HCV is primarily contracted through injection drug use. And as an example, Vermont's prison officials continue to deny access to the cure to hundreds of incarcerated Vermonters diagnosed with HCV. My center and the ACLU of Vermont are engaged in a class action lawsuit to eliminate these discriminatory practices. Yet the Attorney General in Vermont has actually tried to use the pandemic to slow the case down, citing the importance of other COVID-19 responsibilities. The bottom line is, our governments can't use this pandemic as an excuse to ignore sound public health policy, denying life-saving treatment to vulnerable incarcerated people who are living with the communicable disease. If anything, now is the time that we should be prioritizing access to such treatment and the elimination of these kinds of discriminatory barriers. One more quick example. In some parts of the country, state officials are using the pandemic to further anti-abortion agendas. They're claiming that abortion services are non-essential and that they need to stop providing abortions in order to preserve resources for other types of necessary care. Again, this is an example of unsound public health policy and an unreasonable denial of fundamental civil liberties that can't be allowed in the name of the COVID-19 response. Now, let me provide two examples of how here in Massachusetts, we're also seeing government responses that raise legal and ethical concerns. Now, I should say at the start, I think the state, Commonwealth is doing a great job in many respects, but it doesn't mean that there aren't ways that they're falling short. And when they do fall short, again, it is really our obligation to hold them accountable. So Massachusetts has put in place crisis standards of care, which are guidelines to be used when the need for healthcare resources overpower the supply. Here we're primarily talking about ventilators and the serious shortfalls that are being anticipated. The standards focus on triaging resources. Who gets put on a ventilator if we face shortages? The standards, although recently revised, remain very problematic here in Massachusetts, with a chief concern a continued focus on maximizing the number of life years saved. By considering the number of life years saved, the policy explicitly discriminates against older adults as well as those living with other chronic health conditions. And given the impact of social determinants of health, particularly on high rates of comorbid conditions in Black and Brown communities, the criteria of life years saved embeds structural and systemic racism into the decision-making process. So here, the ACLU of Massachusetts and HIPPA have called upon the Baker administration to ensure that there is a more equitable framework here in Massachusetts, one that focuses on likelihood of survival, saving the most lives. We're also seeking timely access to information, data by race and ethnicity, so that public health officials can ensure that the standards are not perpetuating bias and inequities. Massachusetts needs to lead in protecting all of our public health while ensuring that our response does not exacerbate existing disparities. Then finally, narrowing in on a key topic of today's town hall, I want to talk about the tensions between privacy and the public health response here in Massachusetts. Now, state officials have ordered local boards of health to disclose the addresses of people who have tested positive for COVID-19 to local call administrators and in turn to first responders. While I can understand, I think we all can understand the motivation behind such an emergency order, providing residential addresses is short-sighted. It does not make anyone safer and will in fact put our public health responders, first responders, at greater risk. There's no comprehensive or accurate list, as the overwhelming majority of people infected with the virus remain undiagnosed, with many asymptomatic. Relying on information provided by state officials creates a false sense of security, and sound public health dictates that first responders must treat everyone as if they're infected, using universal precautions on all calls. To the extent our first responders lack sufficient protective equipment, the best we can do is remind them what they already know, how to prioritize the use of limited equipment based on the intervention in hand, and how to quickly assess any known risks that might be considered. We need to provide our first responders with the supports that truly reduce their risk and make it possible for them to do their job. However, relying on the sound judgment of our first responders, not disclosure of an ineffective list of addresses, is what is most helpful through getting us through this stage of the crisis. This is a better path forward, along with priority screening, paid time off for our first responders. And here, just to say, privacy and public health interests are aligned. In addition to being dangerously effective to rely on a list, disclosure rules will deter some people from being screened, further undermining public health efforts. Screening is the front line of slowing the spread of this disease. And given the stigma and discrimination surrounding any infectious disease, the idea that our addresses will be disclosed will likely deter some people from being screened, particularly immigrants and other vulnerable communities that already live in fear. Here, an ineffective intervention doesn't justify an exception to privacy protections. So ultimately here, the ACLU of Massachusetts and my center have written to the governor and other state officials to remind them of what is needed here in Massachusetts. We need free and universal testing and treatment. We need improved access to and equitable distribution of personal protective equipment and ventilators. We need up-to-date data that helps to drive an informed response in real time. We need Medicaid, Medicare, SNAP, WIC, Section 8, and our other safety net programs to be flexed up to meet their full potential. But most important, we need to avoid invoking emergency public health orders that actually undermine individual and public health, our civil rights, and our civil liberties. Thank you.
Thanks so much, Robert. I want to remind our audience that you can submit questions if you're on the Zoom call via the Q&A function if you have questions for Robert. Now we're going to move on to the second segment to discuss privacy and surveillance during the coronavirus pandemic. I'd like to introduce Cade Crockford, Director of ACLU of Massachusetts' Technology for Liberty program and leader of our Press Pause on Face surveillance campaign. Cade, thanks for being with us.
Thanks, John. It's wonderful to be here, and thanks for everyone who joined us online. Hope everybody's doing okay out there. Obviously, in these troubling times, the ACLU of Massachusetts is doing everything that we can to make sure that fundamental rights do not get left behind. This world of ours has changed a lot in recent months, but the ACLU's mission remains as urgent as ever. So my focus at the Technology for Liberty program at the ACLU has been in ensuring that the state of Massachusetts response, and to some degree the federal response to COVID-19, favors transparency and privacy to the greatest extent possible. Having defended civil rights and civil liberties for 100 years, our organization was founded in 1920. The ACLU recognizes that times of emergency do sometimes force us to think differently about our rights, including our right to privacy. However, the government must take care not to infringe upon constitutional rights any more than necessary. And when they do, it must be for a limited time. So we all know too well that governments and private corporations often view crisis situations like this as opportunities to seize more power for themselves. That's why the ACLU is working to ensure that any privacy sacrifices we make during this time are necessary, proportionate, and only in the service of public health. To that end, we've sent several letters, as Robert mentioned, to Massachusetts officials outlining our concerns about specific policies and practices and seeking as much clarification as possible on the state's response, particularly as it pertains to data collection. So data sharing can certainly be useful for stopping the spread of this disease. Data can tell us which communities have been hardest hit and where the state's efforts and federal efforts are falling short. I'm going to pull up a PowerPoint presentation, so just give me 1 second. And to share my screen, let me do, here we go. Thanks, y'all. Bear with me here. Okay. Great. So my team at the Technology for Liberty program has, among other things, been using publicly available data to demonstrate racial disparities in COVID-19 hotspots in the greater Boston area, and also to document the effect of the crisis in jails and prisons across our state. So this slide you can see right here is work that our data scientist Lauren Chambers did, outlining what you can see very clearly, which is that there is significant overlap in Boston, as well as other communities around the state, among communities where there are high rates of folks who work in essential services. So we're defining that not only as healthcare workers and first responders, but also people who work at grocery stores, people who work in transit operations, anybody who's leaving their home to go to work right now, that there are high rates of overlap among those populations, neighborhoods who are facing high infection rates of COVID-19, and Black and brown communities in the city of Boston. So you can see that very clearly in these maps. We've also been working at the Data for Justice Project to outline and present for the public information about how prisons and jails in Massachusetts have been responding to the COVID-19 crisis. These data are required to be produced by a Supreme Judicial Court decision in a lawsuit that the ACLU filed with other partners. So you can find all of this information at our Data for Justice website, and we're now linking to that in the chat. So this kind of data, aggregated anonymous data, tends not to raise privacy concerns, but some governments have been going further, gathering more data, sometimes more data than necessary, about ordinary people. And Robert mentioned that. This has also happened under the guise of something called contact tracing. You've probably heard a lot about this. Contact tracing is a tried and true method of tracking infectious disease. It is something that you have probably already heard a lot about, and something that you are absolutely going to hear more about in the coming weeks and months. So right now in Massachusetts, the approach has mostly been to limit the amount of interaction that folks are having, the shelter-in-place order, physical distancing to limit the spread of the virus. You have probably read in recent weeks that the state of Massachusetts has entered into an agreement with Partners in Health to engage in a contact tracing operation. So essentially, contact tracing works like this. Public health officials will interview someone who has tested positive for the disease, in this case, COVID-19, and then they will ask that person for a list of everybody they have recently been in contact with. And the state is defining in contact with right now as within 6 feet of physical proximity for 15 minutes or more. So the officials will then contact each of those people and warn them that they've been exposed and ask them for further contacts, as well as urging those people to self-quarantine. So this is how public health officials develop a picture of how a virus is spreading through communities. And here in Massachusetts, you'll see on the left, this is the logo for the effort that the state of Massachusetts is engaged with Partners in Health. The website for that effort is on the screen as well. This is very useful, obviously, in terms of limiting the spread of infectious disease. And from a privacy standpoint, it's a fairly benign practice when it's done in this old-fashioned way, through interviews and phone calls. Obviously, there are privacy concerns. People are sharing sensitive information, but it can be dealt with in a fairly straightforward way, those privacy concerns. So this is how Massachusetts has been going about it. That's all well and good, but some people believe that contact tracing should go farther, should be scaled up to use technology and surveillance techniques that were initially not designed at all for public health purposes. So we should be clear here. This is a public health crisis, and we should absolutely consider all available tools that might help us save lives and stop the spread of COVID-19. But while some technology solutions may offer public health benefits, they also may pose very significant risks to privacy, civil rights, and civil liberties. In countries like China and South Korea, governments have used cell phone location tracking to keep tabs on people's movements and to sometimes even enforce quarantine orders. As the ACLU's research shows, this type of tracking using cell phones is not only unreliable, it is a civil liberties nightmare. It's an example of how irresponsible privacy infringements can destroy public trust, serving only to spread suspicion and fear. Thankfully, there are better ways, somewhat better ways, to use technology to assist with contact tracing. So you'll see on the right here a graphic from the BBC outlining how a project proposed by Google and Apple works. Google and Apple, as well as research institutions here in Massachusetts, including MIT, have been developing apps that use Bluetooth on personal devices to track the spread of COVID-19. This kind of proximity-based tracking, in theory, allows people to self-identify as COVID positive and alert nearby devices to a risk of exposure, all without sharing any, names, your personal contacts, your location histories, or other sensitive information. But as with everything, the devil is in the details. The details really matter. And so far, we've only seen proposals and heard reports of discussions between governments in the US and technology vendors like these. With these new tools in development, in light of these discussions, the National ACLU has released a set of guiding principles for any Bluetooth contact tracing operation. So what are those core principles? First and foremost, technology cannot replace human-centered approaches to contact tracing. These technologies should only be used to assist in those human-led efforts. Second, any technology usage should be voluntary, that's crucial, and non-punitive. Otherwise, we risk losing public trust, which is necessary for public health efforts. Third, any app must be built in consultation with both public health and privacy experts from the outset. That way, we can ensure that saving lives and protecting our basic rights are the two primary goals. Number 4, users should have control over their data. Governments and companies should minimize the use of centralized databases and allow users to opt in and opt out at will. And finally, any app should be narrowly tailored to respond to this crisis alone, and companies should be ready to pull the plug if one of two conditions is met. A, if the crisis ends, or B, if the apps are shown to be ineffective. So right now, as I said, old-fashioned contact tracing makes the most sense. And so we applaud the state of Massachusetts for its enormous and substantial efforts to engage in a statewide contact tracing program with partners in health. Part of the reason why the human-led efforts are the best option right now is that our state and nation currently lack the COVID-19 testing capacity that would be necessary in order to make these digitally enhanced contact tracing programs even viable. So the urgent need, obviously, and as Robert said, according to public health experts right now, is to expand testing capacity, suppress transmission through physical distancing measures, and ready our hospitals for an influx of patients. It is possible, once new cases start to decline in Massachusetts and testing is more widely available, that some limited use of technology could help us in the future to stop the spread of COVID-19. If, as reports suggest, the state government is considering deploying an app to assist with contact tracing in the future, they should carefully weigh the privacy risks of such an approach and make these risks as minimally invasive as possible. So one of the things that we've been doing in light of our concerns around these issues is that the ACLU of Massachusetts, along with the National ACLU, a few weeks ago filed a federal FOIA request, a Freedom of Information Act request, with the CDC and the Health and Human Services Agency at the federal level to learn more information about what the federal government is doing in its conversations with technology companies, whether any data has been shared, what they're planning to do. So in the meantime, we are remaining vigilant for any unnecessary infringements on privacy and expansions of surveillance during the COVID-19 crisis. You can keep track of our work on these efforts at aclum.org and at the Data for Justice site, which was linked to in the chat. Thank you very much.
Thanks so much, Kate, and I want to thank you again, Robert, for your presentation. We're going to move into the Q&A section of today's virtual town hall. And again, if you have questions, drop them right into the Q&A function, and we'll try to get to them. We did receive a ton in advance, so apologies if we don't get to yours. The first question I want to direct to Robert because of the breadth of experience you have in the public health sphere. And this is a question we received from several people. What prior public health crises, learnings from those crises can be applied to deal with the COVID-19 crisis?
Well, as you can, in the context of AIDS, particularly in the early years of HIV disease, there were many similar challenges that we were facing. I talked about the issue of first responders, for example, and during the start of the AIDS epidemic, the police, firefighter, first responder unions really all pushed very hard to try to get the kinds of names and address lists that in this case has been created. I have to say in that context, the Department of Public Health really stood strong and worked hard to really educate the first responders why that was not a sound practice, hopefully in the ways that I successfully articulated today. I mean, sadly, again, given that so many people are undiagnosed, many are asymptomatic, the list is completely ineffective, and that is not a sound approach to how we should address that. So that's just one of the many examples, but contact tracing, Kate just talked about, all of those kinds of issues came up before. And just to say, I mean, this is over time in terms of public health, we know even in the 1918 flu, epidemic outbreak, there are cases where people did not seek out treatment because they were afraid that if they found out that they had influenza, that at the time the city would put like a placard on people's doors. So again, the basic lesson is we need to reduce all barriers to screening. We need to avoid any kind of stigma, discrimination associated with this disease, because we need people, the way to really stop this epidemic is to have people know that they have the virus and then take the necessary steps to avoid transmission. That's just a lesson learned throughout history.
Thanks so much, Robert. Cade, we're going to pivot over to you. We've got a question from Holly, who is an attendee today, and a couple other people asked this in advance as well. I think this both applies to sort of more broadly before this crisis and in the future, but also during this crisis. What's ACLU been up to in terms of what we're doing about cell phone tracking by government?
Great question. So as many of you probably know, we lack sufficient privacy protections in the United States with respect to our cell phone location information. And so it's been troubling and interesting to watch companies like Google, who profit immensely off of the online advertising marketplace, which is in part fueled by our cell phone location data, pivot and start to talk about how those same technologies that are used to track our associations and locations through our cell phones and produce hundreds of millions, if not billions of dollars of profit for a variety of industries can now be marketed as public health tools. Unfortunately, Congress has not updated electronic privacy law in the United States since 1986. I'm guessing that was before many of the people who are listening to this call were born. I was 3 years old at that time. Cell phones did not exist in the way that they do now. A 1 gigabyte of storage cost about $75,000 and was like the size of the room that I'm sitting in. So it was a very different world. And yet Congress has not taken the steps that they need to update our electronic communications privacy law to ensure that when we leave a digital trail behind us through apps or through the data that our cell phone companies are collecting about our locations, that those data are protected and that they can't be exploited and used to harm us. So unfortunately, in the realm of the commercial side around what companies can do with our cell phone location data, we really have failed to protect our privacy, and we need Congress and state legislatures to step up to the plate and pass legislation that would at least bring us to the level that, countries in Europe, for example, are at with the General Data Protection Regulation, which is probably the worldwide gold standard for consumer data privacy law. On the government side, we're in a significantly better place, and that is largely due to the efforts of the ACLU, both here in Massachusetts and at the nationwide level. So there are a couple cases that we filed out of our office in Boston, essentially arguing that if the government wants to obtain your historical cell phone location information from your cell phone company, they have to go to a judge and get a warrant first. And so we won a number of cases, arguing that at the Supreme Judicial Court, the state's high court here in Massachusetts. And then finally, 2 years ago in the summer of 2018, in an ACLU case called Carpenter versus United States, the Supreme Court agreed and said, if the government is going to demand of your cell phone company that they hand over information showing where you were last week or last month or last year, they have to get a warrant to be able to do that.
Thanks, Cade. We're going to swing back over to Robert. Robert, a couple people asked this question. They're really concerned about HIPAA protections in the time of coronavirus. Can you talk about sort of the overlay of how HIPAA Protections have been working in public health response to this crisis?
Sure. Well, I would just start with saying that certainly that HIPAA as a general rule requires that health information is protected, that the exceptions to those rules are limited and should only be used when absolutely necessary. HIPAA does, for example, in terms of public health information, allows health departments to disclose protected health information. So in this context, again, going back to the first responders, for purposes of either preventing and controlling communicable disease, or if imminent exposure is a potential risk. But again, it's all dependent on effectiveness. And I, hopefully have done a successful job as an example saying, well, one could try to argue that would be appropriate here in this context, the ineffectiveness of the intervention, the fact that the overwhelming majority of people would not be on the list, that you might as well give somebody a telephone book. I hate to say that, but given the extent of the, virus, that, that would not justify that kind of exception. So again, there are certainly limits, and one of the things we need to remain vigilant about is to make sure that our governments and our public health officials do not use these exceptions to the rule to really drive elimination or reduction in our privacy and other civil rights and liberties in the name of an emergency public health order. They have to be highly effective, targeted, limited in order for that to be justified.
Okay, thanks, Robert. Now I'm seeing a couple of really good questions pop up here live. Someone from named Dan is asking, Cade, what do we know about the use of face surveillance to track people with coronavirus, or even to expand sort of government use of face surveillance during this time under the guise of public health protections? And then generally, I kind of want to extend on that. I was hoping you could tell us a little bit about our Press Pause on Face Surveillance campaign and sort of the future of where that is going.
Great question. First, I just want to add something to what Robert said about the HIPAA issue, which is that at the beginning of this crisis, the federal government issued a HIPAA waiver, waiving some portions of that federal health privacy law. And so one of the things that we asked the CDC and HHS about in our FOIA request was how they are using that HIPAA waiver, because we know that they waived HIPAA requirements for some companies, but we don't actually know how that waiver has been used. So we aim to find out and tell the public. With respect to the question about facial surveillance, we have seen that in authoritarian countries like China and Russia, the government has been using facial recognition technology in concert with its other technologically driven COVID-19 suppression efforts. In Moscow, for example, the government has over 100,000 networked surveillance cameras and has been using facial recognition technology to enforce quarantine orders. So there was at least one report of a woman who was subjected to a quarantine order being arrested by the police in Moscow because facial recognition technology caught her leaving her house when she shouldn't have been. We have not heard of any efforts to use the technology like that in either Massachusetts or the United States. That said, as I said in my remarks earlier, that won't stop companies who want to make a profit off of people's fear around the virus from hawking their goods to the media and to police departments and other government agencies. So just this week, we read a story in NBC News about the very shady company Clearview AI, which has scraped the internet, seizing 3 billion or more images of people's faces from websites like LinkedIn, Facebook, Twitter, etc., connected to their, personally identifying information in some cases, and has used that database of photos to create a facial recognition app that enables anybody who has access to it to take a picture of anyone with their smartphone and then see a list of people who are potentially matched to that person's face. So it's a very, very dangerous technology that, if it spreads, will effectively end privacy and anonymity in public space as we know it. Clearview is now marketing their technology as a COVID-19 suppression tool. I have to say, I find those claims laughable. I think that the NBC News story was really just a PR push from a company that wants to be relevant in the midst of this crisis. And I frankly find it appalling, because what we clearly need right now, as we've said, as so many public health experts have said over and over again, is a massive expansion of testing. We need to address the very serious race and class inequities that we're seeing in terms of who gets sick. And in some cases, as Robert said, with the crisis care guidelines, in the worst situations, who may get life-saving care. The last thing that we need to do is supercharge already, in some cases, dystopian surveillance technologies like face surveillance, or give them some sort of makeover and pretend that they're going to help us get out of this crisis. They won't. With respect to what we're doing on the Press Pause campaign, in June, the ACLU of Massachusetts launched a campaign called Press Pause on Face Surveillance. The campaign has 3 goals. The first is to pass a statewide moratorium on the government's use of facial surveillance technology. The second is to pass a series of municipal prohibitions on the government's use of the technology. And the third goal is to educate the public and lawmakers about the dangers this technology poses, particularly unregulated. Right now in Massachusetts, there is not a single law in the books protecting the public interest with respect to the government's use of a technology like facial recognition. The campaign has been successful. We have passed 5 bans at the local level on municipal government use of this technology, most recently in Springfield, as well as Cambridge, Somerville, Brookline, and Northampton. And we are currently engaged in efforts with some other communities across the state to pass similar bans. So I'm going to remain mum on that for now, but if you check the news, I would say next week, you'll learn some exciting information about that.
Thanks so much, Cade. And I want to thank you again, Robert, for participating in this town hall. It was really illuminating, and we really appreciate your willingness to support this effort. We don't have time left for any more questions, but I do want to close out by just thanking everybody who did attend, all of the viewers today. Your interest in our work is deeply important, and the work continues to go on even in these trying times. I did want to say, in the chat area, check it right now, because we did share a bunch of resources and a bunch of media that you may be interested in. I want to say that supporters can sign up and get involved in our advocacy through the ACLU volunteer program. That link is aclum.org/volunteer if you want to sign up for that. I also want to say that our final town hall, which will be about voting rights and abortion access to really the serious issues affected by this crisis, will be on Tuesday, May 12th at noon. You can register at aclum.org/events. And finally, I just want to say, ACLU's work has never been more time urgent. We don't accept government funding, so we rely on our members and supporters. If you're able, please give generously so we can continue to do this work. To donate, go to aclum.org/donate. Again, I want to thank everybody for participating. Thanks to Robert and thanks to Cade for your expertise, and thanks to all the viewers out there. Hope you all stay well. Take care.